It's also worth noting that these are just, influencers who have big social media followings. There have got to be a lot more cases that are out there that are, not as well known or unknown to you, certainly, because they don't have a big social media presence somewhere. Um, what do you think? Do you think that this is more widespread than what you're seeing?
Yeah, I definitely think that there is a concerted effort to hide causes of death that embarrass the trans community, and that includes causes of death that are seen as shameful, meaning drug use, because it implies that they were unhappy with their transition. They were seeking out other forms of drug use to compensate. Or if it's connected back to the transitioning itself, that's also seen as harmful to the trans community and worthy of suppression. And then, of course, there's when they choose to end their lives because they were unhappy in the first place, and the transition didn't prevent suicide. So they're actively trying to like hide when those things happen, and they will reach out to content creators who make reasonable inferences about their suicidal friend suddenly dying, but they won't give them details. And so like in the case of Apollo Moon, uh, some people were attempting to say that he had actually died or she had actually died in a car accident. But I just, as someone who had a family member die in a car accident, that it got reported in the news before we found out, and so I just it seems to strain credulity that there would be no police report, there would be no news report, or something like that was the cause. So it's very perplexing why there's no cause for these young people who shouldn't be abruptly dying.
My guest today is Exulansic, one of the biggest social media influencers in our little world of gender critical influencers. She is best known for her dissections of Jazz Jennings and other transgender influencers. We are going to discuss a rash of deaths among the influencers she follows, and how that informs us about the new wave of females identifying as transgender. Exulansic is a detransitioned trans man and a speech therapist. Welcome to the program.
Thank you.
Um, let's start with these individuals. There are five of them that we're going to be talking about. You say this is in just the last 6 months, correct?
Yeah, I believe the earliest one was in July 23rd. So we might have just passed the 6 month mark.
And the first of these is we're going to talk about them in descending order of age because I think that's really important. Uh, the first one we're going to talk about is Liam Johns, who was 37 at the time of death. Can you tell us about Liam?
Yes, Liam Johns was an influencer, had been featured in several articles related to advocacy for inclusion in opposite sex bathrooms, and later her Seahorse Dad journey, which is when a transitioned female to male who's been on hormones and has had surgeries or otherwise identifies as trans then has a pregnancy. And so she ended up having two children. And then within a few years of the birth of her second child, She passed away she developed kidney failure, first of all, and was put on the transplant list. And a little over a month later, she passed away on dialysis. She also had a history of drug and alcohol addiction, as well as type 1 diabetes since childhood. So all of those factors will exacerbate and make progression to kidney failure more likely. So she left behind two children. And then while she was in the last couple of years of her life, her male partner decided that he was a trans woman, and that he shouldn't be disfavored in like they separated and they were ended up in family court. And he took offense to the fact that she seemed to think that she was entitled to something based on the fact that she had actually given birth to the children, whereas he was just as much of a mom as she was. So it sounds like her last couple of years of her life was very difficult.
And the second of these is Apollo Moon, who died at the age of 26. Tell us about Apollo.
Apollo Moon, also known as Forrest Heriter, I believe the before that was Hannah Heriter. She was a female to male porn actress. And so she produced trans themed pornography as well as BDSM themed pornography. And she, near the end of her life, she had announced that she was going to be leaving the porn industry because of the mental trauma and the difficulty of feeling like what people thought of her body was so important to her finances and her life. She posted to social media about the trauma that she experienced when her nipples fell off in the shower after she had top surgery, and she watched one of them circle the drain. And so she just had a great deal of difficulty. And then shortly before she died, she was posting about how people who are close to somebody who ends their life should forgive themselves because they uh, probably couldn't have done any more, even if they had reached out more often. After her death, the details were not reported officially beyond the fact that she was in the ICU at one point, and then passed away in the ICU. People close to the family, or who claimed to be, had disclosed that it was likely an intentional ending of her life by a car. So she crashed her car in order to try to end her life.
Okay, and the third of these is Griffin Sivert, age 24. And this one, I have to say, deeply affected you. Um, I remember you were holding a space that evening to, sort of process the news. So tell us about Griffin.
Griffin was one of the first people I came across on social media when I started doing this project of trying to document the impact of gender affirming care. And she had received a phalloplasty in 2021 at around she was still at the age of 20 at that time. Um, and so she documented that on her social media, including how much it cost and who the doctor was and all the side effects she had. Her story is that she had come out around age 13, shortly after her parents had divorced, and she began cross sex hormones. Uh, so she was put on testosterone at 14. She had her breasts removed at 17, and that sent her into an opiate relapse because at some point during all this, she became addicted to opiates and recovered from that, got top surgery, and posted about how she had had a relapse because of access that she gained through this gender affirming surgery. And then a few years later, she got the phalloplasty, and that failed really quickly and gave her sepsis. And she ended up in the ICU at the peak of COVID on a ventilator. She almost lost her leg, and then it was just surgery after surgery trying to fix this broken and continuously getting infected urethra. At one point, using skin from the inside of her mouth to try to patch the hole. And then just the whole time her health continued to deteriorate, and she ended up also in kidney failure, on dialysis, and ultimately her last social media post was from the hospital shortly before her death, saying that she'd had a brain bleed. And so it's was reported by someone who was saying they were in communication with her father on Facebook that she had that he had disclosed that she had had another larger brain bleed after that point, and that was the cause of death back in July at age 24. And so she was influenced by Jazz Jennings also, as she posted about on her social media because they were about the same age.
The next one is Spencer Jamie, who was 22 at the time of death. Tell us about Spencer.
So Spencer Jamie was a trans identified TikToker. She was a young woman who had transitioned. I believe she started testosterone also as a minor at 17. And so she had been on this hormone, and she'd also posted uh, other posts that suggested that she may have had an issue with opiates. She posted about Narcan and how long you should wait in between Narcan administrations, for instance, and she'd also had top surgery at some point. Less information is available about her online. Her peers on TikTok immediately suspected that she had ended her life intentionally, and no official cause of death was reported for her. So that was in November.
And the fifth and last of these is Anthony Javelina, or Javelina. I'm not sure how you pronounce that. Age 22. What can you tell us about Anthony?
Anthony Javalana is a 22-year-old who was active in the Filipino DJ community, and there was LGBTQ specific in Sacramento, California. And so a lot of the information about her death is through that community's Instagram, as well as Anthony's TikTok channel. Anthony uh, first came out when she was 14 and began to bind her breasts basically immediately. She began testosterone at 16, and though that she did have a period of time off testosterone, she had resumed it and had been on it for some length of time prior to her death. And she also had had her breasts removed at age 18. Based on her social media posts, a lot of what was driving her to transition was feeling very out of place as a girl and wanting to be more like boys in her community. And her cause of death was also not reported.
So that's five trans men, at least four of whom we know something about how they died. And in at least a couple of cases, it's pretty clear that this is connected to the medicalization, or the medicalization sure did not help. And in one case, we know that somebody, Apollo Moon, committed suicide. So that suicide was not prevented by the gender medicine, as it was supposed to be. Um, so what we have here is sort of a rash of these deaths. And of course, we're not trying to sensationalize or glorify this. Quite the contrary. This is a very sad trend, and we need to discuss it. The first thing that I notice is that in these accounts of these stories, I see risk factors. For example, divorce causing someone's uh, ideation or being connected to a child adopting a transgender identity. That's something that we've seen before. But then you've got sex work, which, in the case of Apollo Moon, that is, that's going to not be healthy. That's not a centering way of life, right? And then you have mental health issues, drug use. Some of these people may have been subject to abuse at some point. We don't know. But these are risk factors that affect physical and mental health. And it seems as though when you add iatrogenic harm on top, you don't actually improve any of these risk factors. Um, what may be happening is that the risk factors are sort of having a multiplicative effect. You're a health professional. I'm not. Do you have anything useful to say, I guess, or do you have any ideas about what this means just sort of for the larger demographic of these young women who are the new cohort of transgender identities? Three out of four, I think.
I think that there is minimal evidence that suicidal ideation predicts likelihood of attempting or completing suicide, because otherwise women would have a greater risk of it, since we ideate more and we attempt more, but we succeed far less. And there's reasons for that. But so it's what we have is a situation where predominantly girls are being told that their ideation is predictive of future self-harm, and that in order to prevent it, they need to take on this other harm in order to try to save their life. But there's actually they're not there's no evidence that these interventions reduce their risk of actually completing a suicide. And there's a lot of evidence at this point that even people who've been through surgeries are at the same level of elevated risk, due to whatever underlying factors led them to think that this was their answer in the first place. It's a sign of mental uh, disorder to think that the reason that you're unhappy is that you're not what you're not. You should be able to come to terms with what you simply are if it's a non-pathological state.
You did mention the sort of relationship between rhetoric about suicide and the ideation around suicide. Um, And I wonder if, does that go hand in hand with the diagnostic overshadowing? Because I'm sure that that's part of this, right? That some therapeutic professionals told these uh, young women that their problems that were mental health, that were trauma, or that were some kind of other problem, that their problems would go away, right? It got overshadowed. Um, do you see evidence of that in watching these sort of transgender influences?
Yeah, I think that there's a strong attitude that if gender dysphoria is present, then it's automatically primary. And so we need to prioritize addressing that immediately over other concerns, because you're not allowed to consider the possibility, because it's conversion therapy, you're just not allowed to consider the possibility that if you treat the underlying issues, the fixation on being the other sex might just resolve and go away because of a shifting in focus and a phase transition in your attitude. Instead, we have to prioritize making the costume permanent and ignoring the autism, the dissociative experiences, the OCD, the other factors that are making their life feel so hard.
It's also worth noting that these are just, influencers who have big social media followings. There have got to be a lot more cases that are out there that are, not as well known or unknown to you, certainly, because they don't have a big social media presence somewhere. Um, what do you think? Do you think that this is more widespread than what you're seeing?
Yeah, I definitely think that there is a concerted effort to hide causes of death that embarrass the trans community, and that includes causes of death that are seen as shameful, meaning drug use, um, because it implies that they were unhappy with their transition. They were seeking out other forms of drug use to compensate. Or if it's connected back to the transitioning itself, that's also seen as harmful to the trans community and worthy of suppression. And then, of course, there's when they choose to end their lives because they were unhappy in the first place, and then the transition didn't prevent a suicide. So they're actively trying to like hide when those things happen, and they will reach out to content creators who make reasonable inferences about their suicidal friend suddenly dying, but they won't give them details. And so like in the case of Apollo Moon, uh, some people were attempting to say that he had actually died or she had actually died in a car accident. But I just, as someone who had a family member die in a car accident, it got reported in the news before we found out. And so I just it seems to strain credulity that there would be no police report, there would be no news report if something like that was the cause. So it's very perplexing why there's no cause for these young people who shouldn't be abruptly dying. And if their health was that fragile, maybe they shouldn't have been put on the testosterone, because the testosterone, like with Griffin and Liam, They both had other conditions too that predisposed them to develop some of these problems. I think Griffin found out about her clotting issue as a result of the phalloplasty, but they could have checked for it before. And Liam, they definitely knew about her diabetes, and they still put her on this drug that exacerbated her kidney issues. Um, Even though she was telling the media that she was also an alcoholic and she was skipping meals in order to pay for alcohol. And that was in like news articles about her.
Yeah, it is kind of amazing how lack of self-awareness seems sort of general to this demographic. Sometimes there are mental health issues and personality disorders there. Um, what do you think about the role of those particular issues in this trans ideation, particularly borderline personality seems to run kind of rampant in the trans man population?
I do think that there's probably going to be an elevated number of personality disorders as well as autism in the trans community because that's kind of undergirding the difficulty with functioning that's being over attributed to not being the other sex or being too much the sex you are. And so there's an encouragement to see that as somehow poisoning the well and causing people to have expectations of you that you're not going to meet. Um, and then at the same time, I think that any kind of developmental delay can make it so that you become preoccupied with the parts of your body that are more sensitive than the other parts because your brain's not filtering that and adjusting it for you most of the time. So it's still like it's just really distracting.
There is an argument that it's a brain body issue, much like, something like anorexia, especially in girls.
People that have that lack of development or some kind of stall as they're kind of coming to grips with the fact that some parts of their body are more sensitive than other parts and their adult body doesn't look like their childhood body. And some people I think just can't kind of compensate for that, or it takes them longer to shift into there's an adjustment period that can be longer for some people for various reasons. I don't think it's helpful to encourage them to by validating that the body is wrong when there's nothing unhealthy about it.
So now that we've discussed this kind of trend and what's going on inside of that trend, I'm in mind of a talk that Wilfred Riley gave at GenSpect in Denver in 2023. You and I were both there, and he had said that we don't actually know the exact size of the new wave of quote unquote trans kids. We can't know the true size just yet, but we could get some idea of its true size. And he came up with a number of something, I think it was 20 to 28,000. And
Mm,
we had research recently that found that it was 14,000 kids that had received quote unquote gender medicine across America. And this was an undercount because there were insurers and insurance systems that, were not included in this survey. So
mm.
at least 14,000. It's going to be some number greater than that. So you have probably tens of thousands of kids who've been through this stuff, and the largest number of them are going to be female, and they're going to be young. Tell us, let's talk about some of what the future holds, because you follow these transgender influencers, and you see their issues. Like you have identified the speech issues of Jazz Jennings and those language issues or sort of oral um, facial issues might be related to something going on in the brain. That's all very interesting. So talk about the effects of these quote unquote therapies on these kids.
I mean, as far as Jazz is concerned, what I see, especially is in the later seasons, is that he seems to randomly lose muscle tone and have his jaw drop open or have his tongue protrude or grimace. And so those can be signs of something called tardive dyskinesia, which can be a result of psychiatric medication or other medication. But it's something's it's a brain phenomenon. And so it's just that's what it looks like. And it looks like it kind of annoys him how that happens as well. In terms of, I know that Griffin Sivert also had some kind of a speech issue where she would often substitute sounds like TH for F. And so that may or may not have been connected to the experiments that were done on her, the hormones that she was injected with. It's hard to say. Testosterone in particular is known to, elevate your risk of cardiovascular problems, in part because it makes blood sludgier, and if blood can't get through those small capillaries in the distal parts of the brain, then that can, over time you're going to lose volume.
Some times you encounter in social media this objection to our objections, where we're told that, oh, you're just obsessed with kids' genitals, but in fact, you just pick your organ, right?
Right.
Um, let's just talk about some organs. Like what is happening, for example, to the pancreas of a girl who's on testosterone?
So the pancreas is sexually dimorphic in that the same dose of testosterone will be too high for a woman but too low for a man, and so it will cause inflammation for both sexes. So elevated testosterone will progressively damage the pancreas by causing inflammation in the cells that produce insulin, among other things. And so it will just kind of lead to chronic inflammation, and that can lead to also pancreatitis that can cause autoimmune issues from the chronic inflammation. And then over a long enough period of time, chronic inflammation can lead to cancer. So then you have pancreatic cancer, which is one of the nastiest kinds of cancer that there is, with a very low 5 year survival rate compared to other forms of cancer.
And of course, you were referring to the heart. And as I recall, females actually receive or have a more elevated risk from testosterone than males from estrogen, but both sexes actually have elevated heart risk. Is that correct?
Yeah, both sexes transitioning have elevated heart risk compared to the opposite sex as well as their sex. I believe for female to male, they end up with like 4 times the risk compared to females, but twice the risk compared to males because their bodies are not designed to adjust for the changes on a chemical level that come from having testosterone. Genetically, they didn't evolve to have those proportions that allow for it, I think.
And let's talk about bones, just to round things out, the skeletal system. You personally have some experience with this. Talk about the effects on the skeleton.
So the effects on the skeleton, if you want to start with puberty blockers, and that can include GnRH agonists such as Lupron, as well as they'll use synthetic progestins to suppress puberty processes, and these suppress the brain function that produces the hormones that cause the gonads to produce the sex hormones. And so by suppressing that, that lowers the levels of all the sex hormones in the female body. Cross-sex hormones such as testosterone is going to have a similar effect of lowering the level of estrogen in the body by turning off the brain, which is turning the brain functions that are turning off the ovary functions. Uh, and as a result of not having those sex hormones when you need them, your if you're young enough, your bones will undermineralize, and then you'll end up with abnormally low bone density at a young age when you should be at or near your peak bone density. And so in my case, even though I was an adult when I was put on the drug Depo-Provera, which is a synthetic progestin, my bones were not finished maturing, and it disrupted that maturation process. And then that left me with osteopenia, which is a abnormally low bone density. It's not osteoporosis yet, but it does carry an elevated fracture risk. And, I'm a pretty young person, 37.
And as part of this, I understand, recently just realized that what they had been doing was doubling your dose. That's a bit
Yeah,
strange. Could you explain that?
uh, they had me on 2 different synthetic progestins at once. So I had an implant that was releasing it continuously. And then they were also giving me a shot every 3 months at the same time. And so they do this for endometrial cancer, endometriosis, and then gender affirming menstrual suppression. And then the idea is basically that they're trying to make that tissue shrivel up and just stop being a problem because it's withered and atrophied. And that was the effect.
You have met with no small amount of opposition sometimes from the people that you comment on and write about. Most recently, you've had James the Nip Noper. You can tell us this. It's a bit amusing because James the
Mm.
Nip Noper decided to organize some false claims under the Digital Millennium Copyright Act.
James, otherwise known as Jamie, that was on this complaint. Her name is Jamie. She was transitioned as a minor, put on testosterone at age 16, and has been on it ever since, with the exception of a period of time where she was pregnant. She stated that she stopped the testosterone because of being pregnant, which to me implies that there was a little overlap at the beginning. And then after she gave birth, she went back on the testosterone gel. And then at some point, she decided that that exposed her baby to too much of a risk of the testosterone gel contact transfer, although she's kind of denied that that was a risk later. But on her own, she decided to switch to injections to get rid of that risk. Um, and yeah, so then we encountered each other. I reposted some of her videos to Twitter with some commentary. Um, and I called her uh, a nip noper because when she had her mastectomy, they removed her nipples, which she was showing us in the videos. And so she made a Twitter account called James the Nip Noper and has just kind of been trolling me since then. And she submitted these DMCA copyright takedown requests that, and then tried to orchestrate and still is kind of orchestrating a campaign to get other people. When I repost something, she goes to them and tries to get them to file a claim against me. And so there's a counterclaim process that you can do to tell X that you don't agree with that, and then at that point, it's the burden shifts back to them to start an actual litigation procedure. And a lot of these people are saying in their initial takedown request that they're doing it because they don't like my commentary and they don't agree with my political perspective when discussing the video and reacting to it and criticizing it. And that further, they think that people are going to get a different impression than they intended from the video, but they can't see how it's fair use. So it's interesting, but there's consequences legally for filing bad faith DMCA claims. The Ninth Circuit, I believe, has said that copyright owners have an affirmative duty to consider fair use prior to filing the takedown request, otherwise damages. And then there's also protections when the litigation is clearly aimed at suppressing discussion of viewpoints that they don't agree with, and they've said that that's what they're doing. So I don't know what they expect to happen.
And who is this TikToker who's trying to take you down by taking off her shirt? What is that about?
Oh, so that's just kind of the latest person to have, I believe, been recruited by James the Nip Noper. And they'll complain about copyright, but then they'll make videos reacting to my tweets, like using images of my tweets that have the entire full tweet in there. So it's like they have an understanding that it's allowed to take other people's material and react to it on your platforms. They know that that's actually allowed, but they don't like the fact that I'm a transphobic turf in their mind. So this latest one is this woman who she had actually posted. I didn't realize even that she was trans, but she had posted about how she had gotten some MRI and they had determined that she basically didn't have a pituitary gland or whatever pituitary she had was like extremely undersized. And it's called empty sella syndrome. And so she was going to have to be put on hormones in order to have a sex drive, and that she's not asexual. She just, her pituitary function wasn't there. And so because of the lack of pituitary function, she didn't have a sexual like feelings. And she didn't have a sexual drive. And I had reposted that with a discussion that like this is what happens when you naturally don't have this organ, but puberty blockers can kill this organ, and then also they in general they suppress the function of this organ. So what does that mean when you give it to someone who's very young uh, for the development? Is it going to reach its full adult size? And what does it mean also if someone's just on it? Like, is it going to change their sexuality? And so it's just, I think it's important thing to discuss. So she didn't like that I was sharing that, and she's accused me of defaming the trans community by suggesting that this drug might have predictable consequences that mirror the consequences that she had. And in order to try to get me to off take my post down, she made a couple videos demanding I do it where she just wasn't wearing a shirt. It was clear that she wasn't wearing a shirt. I mean, nothing, you couldn't see anything, but it was like, it was a lot. And so I said, I don't consent to your shirtlessness. And so she made a video in response that if I took my tweets down, she would put on a shirt. And so as it stands, we remain at this impasse where my tweets are still up and her shirt is still off.
And of course, the joke here, for those who don't know you, who are new to you, is that you are same-sex attracted. Um,
Yes, I like the
and that,
ladies.
yes, and that figures actually in your own story of figuring out yourself and how you went through a sort of transgender identity phase. And that's very common. But more to the point, I keep thinking that there seems to be a relationship. I don't know, maybe I should talk to JD Haltigan. There seems to be a relationship between dysregulation and disease process, if that makes any sense. What do you think?
Hmm. Like emotional dysregulation or
Like mental dysregulation coming apart at the seams and the advancement of a disease process, it seems like almost.
oh yeah, certainly. People things come apart. You're only temporarily the master of your baser drives, uh, while you have your mind. But if you get old enough, or you get mentally ill enough, or you have some underlying disease process, and that person in particular that you were referencing, she strikes me as a bit malnourished, and she's got all these like open sores on her face that she says she does to herself. But I feel like you shouldn't be able to do it that to that level to yourself if you don't already have like some kind of nutrient problem that's making your skin unusually weak. That's just my take. Maybe she is, maybe she isn't. She does seem a little bit obsessive. Um, but if you can get very that person in particular, she's reporting a lot of mental health symptoms, psychiatric symptoms, dissociation, gender dysphoria, um, body focused repetitive behavior causing injury. In other words, excoriation disorder. So it just kind of implies that maybe she lacks some insight into what all these things mean. On top of that, apparently a part of her brain didn't form all the way. But it's like when your brain is what's not working well, it's hard to come to the conclusion that like, oh, maybe my brain's not working that well, and that's why I think I'm supposed to be the other sex. Maybe there's a deeper issue here that if it resolved, all these other things would resolve. But instead, they go to professionals, and the professionals say, no, yeah, yeah, all this other stuff aside, you definitely should be the other sex. It's predatory.
And you know, you say predatory, and of course, you've also chronicled some of the more predatory trans surgeons out there. Sive Gallagher. Tell us about what you discovered about her recently, because you did, in fact, locate some information that had not been made public.
Yeah, it hadn't been widely publicized, and I had help from the glorious people that follow me and watch my videos. But basically, Sive Gallagher used to work in Indiana, and she had a gender clinic in Indiana, and she was featured in news articles about it and all the top surgeries she was doing. While she was there, a 19-year-old named Abigail Suzanne Pierce went to her, and it was reported as a breast reduction, which is often how top surgeries, especially more than a few years ago, were recorded. So Prisha Mosley, another detransitioner, her top surgery was also reported as a breast reduction. So it doesn't mean that it wasn't a top surgery. It was done by a gender surgeon in a gender clinic. So that's, to me, I feel like that's is plausible that it was a gender surgery. Um, in any case, she ended up having a complication from this called a saddle pulmonary embolism, which is when you have a blood clot in your lungs that's so big it blocks both lungs. And so she, I guess, had something that predisposed her to that, but she wasn't adequately educated as to watching for the signs of it, and she wasn't. There was negligence found on the part of Dr. Gallagher by the medical board that reviewed that later. But so basically, Dr. Gallagher had just kind of fled the state. So she just closed up shop and took off and didn't tell anyone, including this patient, and moved to Florida. And a couple weeks later, she started her TikTok channel, and where she continues to make her TikToks. Meanwhile, Abigail died. This 19-year-old died, uh, and there ended up being this major payout. It's unclear exactly how much she had to pay, but there is a fund that steps in and covers the rest for victims of this kind of negligence and malpractice, um, failing to adhere to a standard of care, that paid out a six-figure settlement from the sound of it was part of a larger settlement. But yes, it's a little unclear exactly how much Dr. Gallagher paid out, but she was found to have been negligent in her aftercare instructions.
And of course, this is the famous Yeater of teats, just to be clear. Uh, we've been watching her for years. Folks who have been in this space for a while know about this quack that we're talking about, and her propensity to, joke about slicing healthy breasts off young women.
Well, so she has popped up a few times in my content. Another time she advertises that she doesn't have a BMI cap, for instance, on her surgeries, and so very obese trans people are coming to her to have the breast removed. One in particular who went by Ryder, she had wound separation because of just the sheer weight of pulling on the incisions, and it pulled apart and was like bleeding, and it had become horribly infected. And Dr. Gallagher reportedly discouraged her from going to the ER. And according to Ryder, made jokes about how it was a blowhole and she was just menstruating and that's why it was bleeding. Just kind of a really horrific story. She was also on the show I Am Jazz. She gave Jazz Jennings a pelvic exam and then hired him to be an intern as a condition of him going back to school. And at one point had like allowed him to participate in a top surgery. She doesn't have malpractice insurance that came out with Ryder, so she's going raw, I think is the term, and that makes a lot of attorneys reluctant to sue her because they're not sure who will cover it if they win. And so that's just what she's doing to this day in Florida.
So the picture that I'm getting is that we have now on our hands, before us, a possible wave of young women dying early for reasons that are related or exacerbated to quote unquote gender medicine, and that the professionals who have been the biggest influencers, like Joanna Elson Kennedy and Cy Gallagher, these are some of the worst hack surgeons out there. Um, so it's almost as if this wild west of gender medicine has produced, oh, who could have predicted the tragedies? Who could have predicted the tragedies? Let's talk just for a minute about what I think is probably the worst tragedy of the trans man. It's the matter of dementia in relatively young females, right? Because of the risk factor of the hysterectomy, that they're on testosterone for 5 years, they're told to have their hysterectomy, they get the hysterectomy, and now their risk of dementia, early onset dementia, goes way up. Um, and that brings the uncomfortable picture of parents who are going to have this conversation with their daughter 10 times a day. Daddy, why do I have a beard? Mommy, what happened to my breasts? What do you think the future holds? I actually think that this might eventually get attention that these outcomes are so bleak. What do you think?
I do think that people should be thinking about their long-term risks of dementia. uh, having your uterus out early is a risk factor for early onset dementia. That's true. And then taking drugs that affect how, like blood viscosity, similar to how other things that affect blood viscosity, like having high cholesterol, um, that can also contribute to other forms of dementia, such as vascular dementia. And so, for these reasons, obviously, if they have a stroke, there was that I think 23-year-old who was on testosterone and had a stroke, and now she's locked in, so she can't move any body part except her eyes up and down. It's her only control now, and that's a permanent state. And suppressing the natural cycling too is going to cause different risks, because we don't fully understand what some of these hormones do with that are produced by the pituitary gland that are going to the gonads to produce those other sex hormones. We do know that dysregulation of them is implicated in dementia processes. So as people start to develop dementia and the risk of dementia rises, uh, their risk of being dysregulated in the production of these hormones also rises. And so it's just a question of exactly what the interaction is.
What do you think the future holds for Jazz Jennings? For one thing, you've talked about how the poor boy does not have a sex drive. He does not know what he is. He's not going to have romance because I think the phrase you're using is he's trying to dance to music he doesn't hear. Um, and of course, there you go, is another risk factor. Being unable to form relationships is a risk factor in the future. So, what do you think the future holds for Jazz and kids like Jazz?
I really worry about what the future holds for Jazz. Clearly, he was very affected by the drugs he was put on. He had shown the binge eating behavior since like the very beginning of I Am Jazz. Shortly after they put him on the puberty blockers and the estrogen, and Jazz said that he thought the estrogen was what was making him eat so much. Uh, and so there's that. And he also was complaining about having a lot of pain. He stopped wanting to do sports. Um, it's just unknown exactly what these experiments did to his bone structure, what they did to his brain. Obviously, you can hear from his voice that certain structures you would have expected to develop at puberty just didn't develop. And so he sounds like a very immature boy. He doesn't sound like an adult woman when he talks. Um, and so what else in his body didn't fully develop as a result of these experiments? So I don't know. It's known that cross-sex hormones and blocking your native hormones for men causes their brain to shrink, according to MRI studies from before and after they went on the hormones, at a rate something like 10 times the background rate. And so combine that with somebody who was put on them when he was still developing, so he never even reached his like peak brain density that he was supposed to reach. That was completely stunted, and then normal aging degeneration kicks in. I don't know when he's going to start having problems, if he's already at that point, and that's why they ended the show. They didn't really explain why I Am Jazz was over.
I was going to ask, why is I Am Jazz over? Uh, you are probably the most informed person to speculate. Do you think it's because the issues that were created by the um, gender medicine, you think those issues are too obvious now?
Yeah, I think it's going to be progressively obvious that he's not keeping pace with his peers. I think it was already pretty obvious in the last couple seasons that he doesn't really understand uh, those kind of dynamics when they're not very structured and facilitated by the camera crew. Like I just feel like he's like in season 7, especially the way that he would talk about his food and the way that people would bully him about it was just heartbreaking. And while more recently he does seem like he's lost weight, it's also become a very faddish thing to go on Ozempic. And so I wonder also if they gave up trying to have him actually lose weight a healthy way, and they're just trying to do it this way, and then maybe there's going to be a grand comeback in their mind. Like it's really hard to know what's actually going on, but it always struck me as very strange that they're not really talking about it. that the series just ended.
Is there anything that you'd like to tell us today that we should be talking about that we're not talking about with these, especially these kids?
I think the big thing that we need to start thinking about is the fact that the hormones that are used for puberty suppression and gender affirming menstrual suppression, that sometimes they're also accessible to girls for birth control reasons. And I think it's overdue to have a serious conversation about the wisdom of allowing that, because that seems to be like just an obvious backdoor, at least for the females, to being able to disrupt their normal healthy puberty processes without parent consent or even knowledge.
Exulansic, thank you so much for joining us today.
Thank you.